Welcome to This Explainer. Today, we are tackling something absolutely crucial for mental health professionals. How do we actually bridge the gap between that very first client meeting and a highly effective, personalized treatment plan? It's a pretty fascinating process, honestly, because it requires this incredibly delicate balance of hard science, genuine empathy, and some serious strategic planning.
Have you ever really wondered how a therapist takes this massive pile of abstract intake paperwork and transforms it into a clear, actionable roadmap for healing? Building that bridge from an initial assessment to an actual intervention is literally the core of clinical practice. It's not just about, diagnosing what's wrong. It's about knowing exactly how to guide someone toward what is right.
So, to understand this whole journey, we're going to follow a literal clinical timeline. We'll be looking at assessment and therapeutic alliance, the case conceptualization bridge, collaborative goal setting, formulating the treatment plan, and finally, feedback and outcome monitoring. Let's just dive right in. Starting off with step 1, assessment and therapeutic alliance. Because, let's be real, you simply cannot formulate a successful plan without a rock-solid foundation of trust. Now, assessment isn't just cold robotic data gathering. Imagine an older client comes in, saying she wants healthy coping skills, but then she ends up spending the entire session just venting about her daughter. A skilled therapist doesn't just interrupt her to fill out a checklist on a clipboard. Instead, they use empathic validation right then and there. They listen for the emotional context to form a genuine human connection, because that empathic attunement, that acts as a secure base for everything that follows.
Moving right along to step 2, the case conceptualization bridge. Once you've got that initial data and you've established some rapport, therapists need a sort of GPS to navigate the client's unique landscape. Case conceptualization is the actual bridge connecting a client's past experiences to their current patterns and their future treatment. It is essentially the ultimate cognitive map. It's a clinical strategy for organizing all that messy information, explaining the situation, anticipating potential roadblocks, and really prepping for a successful treatment journey.
Think of it kind of like this. A diagnosis simply names the problem and categorizes the symptoms, right? It's just a static label. But case conceptualization, that explains exactly why the problem exists in the first place. It identifies behavioral patterns and provides a totally tailored rationale for how to actually fix it. If you rely solely on a diagnostic label, you completely miss the individual. Conceptualization makes sure the treatment is built for the actual person, not just the clinical category they fall into. Just to give you a concrete example, a tool like the Schema Mode Map visually links a client's early unmet needs directly to their current coping behaviors. By looking at a visual map collaboratively, the whole dynamic shifts. Instead of implicitly asking, "What is wrong with you?" you start exploring together, "Hey, what happened in your life that taught you to cope in this specific way?" It's a real game changer. Okay, step 3, collaborative goal setting. With our map sketched out and the client starting to actually see their own patterns, the therapist and client have to mutually agree on where they're headed next. The research strongly emphasizes that the absolute best approach here is full transparency. Seriously, therapists should openly share their diagnostic impressions and their hypotheses. Why is that so absolutely crucial? Well, it ensures the treatment frame is built with the client as a true partnership, rather than just decided for them behind closed doors. It models mutual respect and shared agency right out of the gate. Which brings us to step 4, formulating the treatment plan. Now that the destination is clearly set, the therapist has to pick out the right vehicle for the journey. Treatment formulation, you should know, is not just a one-and-done event. Actually, scratch that. It's more like a dynamic, continuous 4-step loop. Assess, set goals, intervene, and reassess. This constant loop makes sure that every single intervention, whether we're talking cognitive restructuring or behavioral training, is tightly tied to those evolving goals. It just keeps the therapy entirely locked in on positive change. As those interventions are applied, the therapy naturally progresses through 3 specific orders of change. First order change is really all about stability, just reducing those immediate pressing symptoms. Then, second order change goes a lot deeper, helping the client develop entirely new adaptive behavior patterns. And finally, third order change. This is the ultimate goal, folks. The client basically becomes their own therapist. They become capable of independently navigating their own emotional terrain long after the sessions officially end. And finally, step 5, feedback and outcome monitoring. Because, let's be honest, what happens when therapy drifts off course? Because it almost certainly will at some point.
That brings us to our final structural pillar.
Check out this staggering statistic. Research shows that using routine outcome measurement, which is essentially just asking the client for regular feedback on how they think they're doing, drops the deterioration rate in at-risk patients from 30% all the way down to 12%. Think of it like a therapeutic GPS. If the data shows you're taking a wrong turn, the therapist can immediately reroute and repair the relationship before the client gets frustrated and drops out.
So we've successfully bridged the gap from an initial empathic assessment all the way across the conceptualization bridge and into continuous feedback. By viewing therapy as this structured, co-navigated journey, it really begs a question for all of us. How could utilizing a transparent, collaborative map change your own approach to solving the complex problems in your life? Continuous feedback and a clear conceptual map aren't just clinical tools for therapists. They're the keys to real, lasting change for anybody. Thanks so much for joining me for this explainer.